With funding support from the Leonard Davis Institute of Health Economics, our research evaluated nurse staffing conditions in hospitals just before the COVID pandemic hit New York City in early March. We also studied the consequences to patients of chronically understaffing hospitals. We surveyed registered nurses in Illinois and New York State in January and February of 2020. We collected detailed information from over 90,000 nurses about their working conditions and job outcomes. We linked this data with Medicare claims data to describe variation in hospital nurse staffing, as well as its consequences for nurse job outcomes and patient health outcomes. In 254 hospitals, we found substantial variation in patient-to-nurse staffing ratios on medical and surgical units. The average staffing was 5.6 patients per nurse, ranging from 3.3 to nearly 10 patients per nurse. Interestingly, while there were some New York City hospitals with low staffing ratios, the majority of New York City hospitals were among the hospitals with the worst staffing. Half of hospital nurses reported experiencing burnout, and roughly 1 in 5 intended to leave their job within a year. Remember, these data were collected in the weeks prior to the pandemic overwhelming New York City hospitals. Nearly half of nurses gave their hospitals unfavorable grades on patient safety. A third gave unfavorable grades on infection prevention, and almost 70% would not definitely recommend their hospital. The majority of nurses report their work was frequently interrupted or delayed by insufficient staff. Using regression models, we found that higher patient-to-nurse ratios were associated with higher odds of a nurse being burned out, dissatisfied with their job, intending to leave, as well as poor quality ratings of their hospital. We examined patient HCAHPS scores and found patients were less likely to give their hospital a high overall rating or recommend their hospital to family and friends if they had attended a hospital with high patient-to-nurse ratios. In our next study, we found that each additional patient in a nurse's workload was significantly associated with higher odds of in-hospital mortality, 30-day readmissions, and longer lengths of stay for both surgical and medical patients. We also found that if hospitals improved nurse staffing to a 4-to-1 ratio on medical and surgical units, we conservatively estimated that over 4,000 lives would have been saved and over $720 million could have been saved through shorter lengths of stay and avoided readmissions. In summary, our studies resulted in the following major conclusions. There's large variation in nurse-to-patient staffing ratios across hospitals. Most hospitals are staffing worse than recommended safe ratios. Understaffing hospital nurses is associated with poor nurse job outcomes, including burnout and intention to leave, as well as poor patient outcomes, including higher odds of mortality, readmission, and longer lengths of stay. If hospitals staffed at the recommended ratios, thousands of deaths could be avoided, and hospitals could realize significant cost savings through reduced lengths of stay and avoided readmissions.